The pregnant body, first trimester. The first trimester is the earliest phase of pregnancy. The first trimester starts on the first day of the last period, which is actually before the pregnancy even occurs. The first trimester will last until the end of the 13th week. About 25% of pregnant women have slight bleeding during their first trimester. Early in the pregnancy, light spotting may be a sign that the fertilized embryo has implanted itself in the uterus. Implantation bleeding will be pinkish or brownish in color. There will be no visible clots, and it will include light flow or spotting that lasts only a few days. If a pregnant woman has severe bleeding, cramping, or sharp pains in the belly, notify the doctor right away. These could be signs of a miscarriage or an ectopic pregnancy. An ectopic pregnancy is one in which the embryo implants itself outside of the uterus. For example, in a typical pregnancy, the fertilized egg will be implanted in the wall of the uterus. In an ectopic pregnancy, the fertilized egg may be implanted in the fallopian tube, causing major health risks to the mother and death to the embryo. Some signs of a ruptured ectopic pregnancy include pain in the lower back, pain in the shoulders due to a leakage of blood into the abdomen affecting the diaphragm, dizziness or fainting, and sudden severe abdominal or pelvic pain. Sore breasts are one of the earliest signs of pregnancy. This happens due to the hormonal changes of pregnancy, and it prepares the milk ducts to feed the baby after birth. The breasts will probably be sore throughout the entire first trimester. Some remedies for breast tenderness include wearing a supportive bra, applying an ice pack, taking a warm bath, and wearing loose-fitting clothing. The breast size also changes during pregnancy. Going up a bra size or even more can make a pregnant woman feel more comfortable. A pregnant woman probably won't go back to their regular bra size until after the baby is finished nursing. Other changes in breast appearance include nipples that become more prominent and areolas that become larger and darker, caused by hormonal changes. Constipation is a common sign of first trimester pregnancy. During pregnancy, high levels of the hormone progesterone act to slow down smooth muscle contractions. These muscle contractions normally move food through the digestive system. Slowing down these muscle contractions leads to constipation. Some remedies include iron supplements, eating more fiber, drinking extra fluids, increasing physical activity, and adjusting the position on the toilet. For example, lean forward with your knees on your elbows. Place feet on a stool so that knees sit higher than the hips. Straighten your spine and concentrate on breathing into the bottom. Most women may notice a change in discharge during pregnancy. It's normal to see a thin, milky white discharge called leukorrhea early in the pregnancy. A pregnant woman can wear a panty liner if it makes her feel more comfortable. However, she should not use a tampon because this could introduce germs into the vagina. The quality of the discharge should be monitored, and abnormalities should be brought to the attention of your doctor. This includes having a heavy discharge, large quantity, or if it is thick or foul smelling, or if there's any other changes that may be of concern. In the first trimester, the woman's body is working hard to support the growing baby. This means a pregnant woman will get tired more easily than usual. The pregnant woman should be sure to take naps and rest when needed throughout the day. Also, making sure that the pregnant woman has plenty of iron is important in fighting this fatigue. It is not uncommon for a woman's body to be depleted of iron during pregnancy. If iron becomes depleted, it can lead to anemia, which can make a pregnant woman feel even more tired. Food likes and dislikes often change during pregnancy. You may notice craving for some foods that you really didn't want before, and some foods or smells may even trigger nausea or vomiting, even from foods you used to like. Giving in to cravings from time to time is okay, but Most of the time, the pregnant woman should eat healthy, low-calorie foods. The top 5 pregnancy cravings are sweets, including chocolates and candies, savory, high-calorie carbs such as pizza and chips, animal protein such as steak or chicken, fruits, and savory, high-calorie dairy, including cheese and sour cream. A rare condition that may develop during pregnancy is a condition called pica. Pica is a condition that involves craving for non-foods such as clay, dirt, and laundry starch. Pica can be an indication of a nutrient deficiency, and giving into such cravings can be harmful and dangerous for the pregnant woman as well as the baby. If a pregnant woman experiences this kind of craving, it should be reported to the doctor right away. Frequent urination is a common symptom of first trimester pregnancy. During the first trimester, the baby is still pretty small. However, the uterus grows at a tremendous rate, putting pressure on the bladder. This pressure makes a pregnant woman feel like she has to go to the bathroom all of the time. It is important to encourage a pregnant woman to not stop drinking fluids. However, she should cut down on caffeinated beverages, which stimulates the bladder, especially before bedtime. Also, when nature calls, answer it as soon as possible. Don't hold it in. Heartburn is a frequent complaint for pregnant mothers in their first trimester. During pregnancy, the body produces more of the hormone progesterone. Progesterone relaxes smooth muscle, like those in the digestive tract. These muscles normally keep food and acids down in the stomach. However, in pregnant women, progesterone causes these muscles to loosen, causing acid reflux and heartburn. Some remedies to pregnancy heartburn are to talk to your doctor about safe antacid options. Wear loose clothing, limit fried, spicy, or gassy foods, drink plenty of liquids, take care of stress, enjoy smaller portions, and avoid slouching, bending, or laying down after eating. Mood swings during the first trimester are common. Increased fatigue and changing hormones can put a pregnant woman on an emotional roller coaster. A pregnant woman can easily jump from feeling joyous to feeling miserable, or from feeling hopeful to feeling terrified, all in a matter of seconds. Some tips on coping with mood swings during pregnancy are getting plenty of sleep, begin journaling or meditating, do low-impact exercises, eat a healthy pregnancy diet, communicate with your partner and doctor, don't feel guilty for mood changes, and it's okay to cry. Above all, the pregnant woman should be very good to herself. Nausea is one of the most common pregnancy symptoms. Up to 85% of pregnant women will have it. It results from the hormones changing in the body, and it can last through the entire first trimester. For some pregnant women, the nausea may be mild, but for others, it can start upon awakening and last all day. Despite its name, morning sickness can happen any time of day. Morning, noon, night, or even all day. But morning sickness is most common in the morning. Some remedies to combat morning sickness: try to eat small, bland, or high-protein snacks like crackers, meat, or cheese. Sip on water, clear fruit juice, or ginger ale. Nausea itself isn't anything to worry about, but if it is severe or just won't go away, it can affect the amount of nutrients the baby gets. Call the doctor if the pregnant woman can't stop throwing up or can't keep down any food. During the first trimester, a pregnant woman should gain about 3 to 6 pounds. However, the doctor may suggest a pregnant woman adjust the weight gain up or down if she started out the pregnancy underweight or overweight. A pregnant woman only needs to have about an extra 150 calories a day during the first trimester. Getting those calories in a healthy way is the best benefit for both mother and baby. Encourage adding extra fruits, vegetables, milk, whole grain bread, and lean meats to the diet. During the first trimester, or 13 weeks, the baby changes from a fertilized egg into a fully formed fetus. All of the major organs and systems are taking shape. This means that the baby can be very easily harmed if a pregnant woman uses street drugs, has an illness, gets exposed to radiation, or uses a prescription drug without the prior approval of the doctor. By the end of the first trimester, the baby will be about 2.5 to 3 inches long. After the first trimester, the risks of miscarriage greatly decrease. Many women attest that the first trimester is the hardest of the 3 trimesters. It may be of some comfort knowing that better times likely lie ahead. Thank you for watching.